What is the most appropriate action when a CNA notices a resident's dentures are missing? A. Immediately notify the family. B. Ignore the situation. C. Inform the charge nurse. D. Ask another resident if they have seen them. Answer: C. CNAs must report missing personal items such as dentures to the charge nurse, who will initiate the appropriate procedures. Which of the following is a sign of hypoglycemia in a diabetic resident? A. Rapid breathing. B. Flushed skin. C. Cold and clammy skin. D. Increased urination. Answer: C. Hypoglycemia often presents with symptoms like sweating, shakiness, and cold, clammy skin due to low blood sugar levels. The CNA's role in the care plan meeting is to A. Approve treatment orders. B. Provide information about the resident's condition. C. Create the care plan. D. Prescribe medications. Answer: B. CNAs provide vital input based on daily care interactions but do not create or approve care plans or prescriptions. When transferring a resident with one-sided weakness from the bed to a chair, the CNA should position the chair: A. On the weak side. B. At the foot of the bed. C. On the strong side. D. Directly behind the resident. Answer: C. Positioning the chair on the strong side maximizes the resident's strength and safety during the transfer. A resident is agitated and trying to get out of bed. The CNA should A. Restrain the resident immediately. B. Call 911. C. Speak calmly and redirect the resident. D. Leave the resident alone. Answer: C. Redirection and calm communication are key in de-escalating agitation without the use of restraints. What is the best way for a CNA to identify a resident before giving care? A. Ask a coworker. B. Check the room number. C. Ask the resident to state their name. D. Call the resident by name without checking. Answer: C. Verifying the resident's identity directly ensures safe and appropriate care. A resident with a feeding tube should be positioned in which way during feeding? A. Supine. B. Prone. C. Semi-Fowlers or Fowlers. D. Trendelenburg. Answer: C. Elevating the head prevents aspiration during tube feeding. If a CNA finds a resident on the floor, the first thing to do is A. Help the resident back to bed. B. Call for help and check for injuries. C. Scold the resident. D. Get the nurse and leave the resident alone. Answer: B. Ensure the resident's safety by checking for injuries and getting assistance before moving them. What is the proper way to clean the perineal area of a female resident? A. Back to front. B. Side to side. C. Circular motion. D. Front to back. Answer: D. Cleaning from front to back prevents the spread of bacteria from the rectal area to the urethra. A CNA is assigned to care for a resident in isolation. What is essential before entering the room? A. Checking the resident's temperature. B. Applying PP, personal protective equipment. C. Asking permission. D. Calling the doctor. Answer: B. PP prevents the spread of infection and is required when entering isolation rooms. The most accurate method for measuring a resident's liquid intake is to A. Ask the resident how much they drank. B. Estimate by looking. C. Measure in ml using a graduated container. D. Record the number of cups only. Answer: C. Fluid intake should be recorded precisely in milliliters using measuring devices. When caring for a resident with Alzheimer's disease who is pacing, the CNA should A. Restrain them. B. Try to stop the pacing. C. Ensure a safe environment and observe. D. Force the resident to sit. Answer: C. Pacing is common and not harmful. Safety and supervision are the main concerns. Which of the following should be reported to the nurse immediately? A. A resident sleeping during the day. B. A resident refusing dessert. C. A resident with chest pain. D. A resident who wants to watch TV. Answer: C. Chest pain can indicate a serious condition such as a heart attack and requires immediate attention. The most important reason to bathe a resident regularly is to A. Prevent boredom. B. Make them feel good. C. Promote circulation and prevent infection. D. Use up supplies. Answer: C. Bathing helps keep the skin clean and reduces the risk of infection and skin breakdown. When assisting with ambulation, the CNA should always A. Use a gait belt if required. B. Walk behind the resident. C. Pull the resident along. D. Let the resident walk alone. Answer: A. Gait belts provide support and safety during ambulation. The term NPO means A. No personal outings. B. Nothing by mouth. C. New patient orders. D. No physical observation. Answer: B. NPO, from Latin nil per os, means the resident cannot have anything by mouth. The proper technique for removing dirty gloves is to A. Pull them off by the fingers. B. Shake them off quickly. C. Turn them inside out one at a time. D. Reuse if clean. Answer: C. Turning gloves inside out during removal prevents contamination. Which is the best example of objective data? A. The resident seems sad. B. The resident says she is tired. C. The resident has a temperature of 101 degrees Fahrenheit. D. The resident appears to be in pain. Answer: C. Objective data is measurable and observable, such as temperature readings. What is the most effective way to prevent the spread of infection? A. Wearing gloves at all times. B. Using hand sanitizer occasionally. C. Frequent hand washing. D. Changing clothes daily. Answer: C. Hand hygiene is the most effective method to prevent infection transmission. Before feeding a resident who is sitting in a wheelchair, the CNA should A. Lock the wheels. B. Put on socks. C. Take their pulse. D. Measure blood pressure. Answer: A. Locking the wheels ensures the resident's safety during feeding. A CNA observes a resident being verbally abused by a staff member. What should the CNA do? A. Ignore it. B. Report it immediately. C. Join in joking. D. Wait until the next shift. Answer: B. Abuse must be reported immediately to protect the resident and comply with the law. When providing oral care to an unconscious resident, the CNA should A. Place the resident in supine position. B. Keep the mouth wide open. C. Use only water. D. Turn the resident to the side. Answer: D. Turning the resident reduces the risk of aspiration during oral care. The first step before assisting a resident with a bedpan is to A. Close the window. B. Raise the head of the bed. C. Wash your hands and put on gloves. D. Announce the resident's need to others. Answer: C. Standard precautions, like hand hygiene and gloves, are critical before handling bodily fluids. Which is a sign of possible dehydration in a resident? A. Frequent urination. B. Dry mouth and cracked lips. C. Sweating. D. Cold skin. Answer: B. Dry mouth and cracked lips often indicate a lack of adequate hydration. What should the CNA do if a resident starts choking and cannot speak or cough? A. Give water. B. Encourage deeper breaths. C. Perform abdominal thrusts. D. Wait to see if they recover. Answer: C. A complete airway blockage requires immediate intervention with abdominal thrusts. Which of the following is considered a restraint? A. Bedside commode. B. Lap belt tied to a wheelchair. C. Walker. D. Open bedside rail. Answer: B. Anything restricting movement, like a tied lap belt, is considered a restraint. What does the term aspiration mean? A. Breathing normally. B. Vomiting. C. Inhaling food or fluid into lungs. D. Loss of appetite. Answer: C. Aspiration refers to the accidental inhalation of food, liquid, or other substances into the airway. When should the CNA document resident care? A. Before giving care. B. At the end of the shift. C. After giving care. D. Only if asked. Answer: C. Care should be documented after it's provided to ensure accurate records. Which of the following actions helps prevent pressure ulcers? A. Keeping the resident in one position. B. Applying lotion only. C. Repositioning the resident regularly. D. Feeding once daily. Answer: C. Frequent repositioning relieves pressure and prevents skin breakdown. A resident tells the CNA that he feels worthless and wants to die. What should the CNA do? A. Ignore the comment. B. Report it to the nurse immediately. C. Tell the resident to cheer up. D. Talk about something else. Answer: B. Any statements about self-harm must be taken seriously and reported immediately to the nurse.